First case was a 1-year-old child who is treated here at Rady Children's Hospital. Fortunately, they're going to be okay, but doctors say measles can be serious, and because it's so contagious, they want people to be aware.
San Diego just had our first case since 2019.
Edmund Milder is a pediatric infectious disease specialist at Rady Children's Hospital in UC San Diego. He says the 1-year-old who was recently diagnosed had traveled internationally with her family and came back sick with a variety of symptoms, including a runny nose, cough, high fever, red eyes, and eventually a rash, all things parents should look out for.
The classic rash starts around the face and then moves down the body.
The child was not vaccinated. On average, kids in the United States get the first dose of their MMR vaccine at age 1, followed by another before they start school. That, coupled with an international trip, made the child more susceptible.
And that's because the vaccine is highly effective, and luckily for most of the United States, we've got good vaccine coverage. But that's not true around the world, and we're seeing big outbreaks in different parts of the world.
While our vaccine rates are good compared to other countries, according to the CDC, they've gone down in recent years. From the 2019-2020 to the 2021-2022 school year, vaccination rates among kindergartners declined from 95% to about 93%, which experts say has contributed to the resurgence of measles.
At the beginning of the pandemic, a lot of that was access. People just didn't have an easy way to get into their pediatrician's office. And I think what we're seeing now is some vaccine fatigue. With the pandemic came all new vaccines to learn about, different visits, and some people have just fallen behind and haven't caught back up.
Measles, which is a viral infection, used to be common among children.
Physicians today know that measles is more than a nuisance.
In 2000, it was considered eradicated in the U.S. Dr. Milder says while this latest case should not cause panic, measles can be serious, which is why people need to be aware.
About 1 in 1,000 people that gets measles will get inflammation of their brain, encephalitis, and 1 in 1,000 can die. For most people, they'll make a full recovery. The trouble is highly contagious.
Dr. Milder says getting vaccinated is the best way to protect yourself against measles. As for this latest case, county health officials have alerted those who may have been exposed between January 28th and February 1st at one of 4 locations. The incubation period can last up to 21 days. At this point, no additional cases have been confirmed. Shannon Handy, CBS 8.